Good morning. It's Dr.Pettle back. This is the second in a series of lectures I'm going to do on women's health. Uh, my father once said to me, Alfie, plant a seed where a tree will grow, under whose leaves you'll never have shade. So this is to future generations, to the girls in my family Lori, my oldest daughter, my middle daughter Sharon, and Tricia, also to Shannon, and to the other Tricia in our family, Adam's Tricia. Also dedicated to Sherry, who works in the office as well. My father was a man who had a great deal of a feeling about sayings, what to do. He was very friendly, and along with my mother, I don't think my brothers and I ever realized how lucky we were to be blessed with such great parents. So this is dedicated to my children and my children's children, who will be mentioned on my next lecture. P.M.S. is premenstrual syndrome. Premenstrual syndrome is divided into 4 categories. P.M.S.A, anxiety. P.M.S.C, cravings, usually salt and sugar. P.M.S.H, hydration, breast pain. And P.M.S.D, depression. And in my experience over the last, 25 years since I've been doing natural medicine, progesterone cream probably treats 3 of those 4 very beautifully, in different doses, of course. That's the whole beauty of doing natural medicine, is to be able to individualize each patient's dose. P.M.S.A, anxiety, depends on the patient's ability to tolerate estrogen. Believe it or not, when a girl has her first period, called menarche, which, by the way, is preceded by thelarche, which is 1 year before, when a young girl develops breast buds and axillary hair. When a girl has menses, the onset of menses, very often, but not always, if a girl has a later onset of menses, she's very estrogen sensitive, and she's usually tall and thin. If a girl has an early onset of menses, they are more tolerant of estrogen, so their bar of estrogen they can tolerate is lower. So talking about a woman who has a very low bar of estrogen, they have greater symptoms of anxiety and P.M.S.A for the following reason. If a normal cycle contains menses, it's usually followed by the brain saying, we'll try again. So the brain produces a hormone called FSH, follicular stimulating hormone, and the body responds to the ovary, says, okay, here's your estrogen. Estrogen is yang. It makes things expand. The lining gets bigger, thicker, and at the point as estrogen rises up to the point of the threshold of that particular female, the body and the brain will say, whoa, that's far enough, we won't take much more of that. And that's where we get into trouble, of course, in perimenopause and P.M.S. symptoms, when there's no progesterone to follow estrogen. So the brain will then say to the ovary, make progesterone. And progesterone is secreted under perfect circumstances under the influence of LH, luteinizing hormone. So luteinizing hormone elevates. It's a way for infertility couples, for example, to know when the patient is fertile. So as the patient has the release of progesterone, estrogen, the yang, is then followed by the yin, progesterone, which is a natural relaxant. So that's a perfect cycle. That's harmony. One day I'll show you the complexities of the balancing of hormones, but we'll start off today with the P.M.S. estrogen-dominant patient. Now picture that same patient who's now 35 to 50, who cannot produce progesterone every month. Picture a teenager who doesn't produce ovulation, doing an exam, running a triathlon. So if no one has progesterone to follow estrogen, estrogen can rise above the comfort zone. As it goes above the comfort zone, it releases cortisol, because the body is on fight, flight, fright. Adrenaline and noradrenaline are released, releasing all the symptoms, anxiety, irritability, insomnia, and basically a very anxious patient, and producing also, even in perimenopausal patients, high cortisol, which produces a bit of fat around the middle. So estrogen dominance is the problem in P.M.S.A. We have to understand that estrogen is a very complicated subject. We take in estrogen orally in our stomach, and we also produce estrogen in our ovaries, those of us that are blessed with ovaries. A patient who takes in estrogen does a very strange thing in food. It goes into the stomach, gets absorbed by the liver, and then gets metabolized and put back into the bowel, and goes down in the bowel and then excreted in the feces. So obviously, if you have, for example, constipation, the estrogen will stay in the bowel longer, and therefore you'll absorb more estrogen. It'll be more estrogen dominant. So anybody who takes more fiber is likely to have less PMS-A symptoms. You also have patients who have estrogen in the liver and excreted into the bowel that can't get rid of the estrogen for another reason. The liver is a very clever organ. It encapsulates the estrogen in a compound called gluconide, and that allows the estrogen to not be reabsorbed into the bowel. So if a patient has healthy bacteria, then the estrogen can go through the feces into a waste so that the estrogen is not absorbed. But now picture a patient who doesn't have healthy flora. Healthy bacteria will allow the bad bacteria not to grow. Bad bacteria in your bowel breaks that capsule and then releases the estrogen into the patient's system. So once again, by taking products like calcium glucarate and I3C, along with milk thistle and dandelion, would all help the liver to metabolize the estrogen properly and excrete the estrogen properly. So once again, the products that we use, called, for example, Estrosense, contains indole 3-carbinol, calcium glucarate, and also milk thistle, all in order to enable the body to get rid of the estrogen. Red meat and dairy, as I stated in my first lecture, if you're a menstruating woman, eat those only during your menses, because estrogen is all over the place. It's estrogen dominance in the whole world. And one word you're going to take away from this lecture is estrogen dominance. The ratio between estrogen and progesterone should be about 20-1. Sometimes I see 1,000-1 when a patient's blood tests are measured. So try and understand that metabolism of estrogen is very important in prevention of breast cancer and PMS-A. PMS-A is the most common of all the anxiety disorders that I see in my office, and it's related to estrogen triggering cortisol. Now, as a further point, if you look at your neck being the top of a triangle, the ovary and the adrenal being the bottom of the triangle, you have a triangle of energy. Now picture an ovary and adrenal screaming for help because they want to produce more estrogen and more cortisol. And now picture a thyroid that says, I give up. So very often you're going to have subclinical hypothyroid symptoms in a patient who has estrogen at a high level all the time. So that's why subclinical hypothyroid is something that we watch for all the time, giving patients things like iodine and tyrosine to help enhance the ability of the thyroid to respond to the brain's needing more thyroid for the ovary and the adrenal. As you can see, it's extremely complicated, but the patient as an individual have a different level of a threshold for each person. So you can't give one patient, without getting a complete history, including when their first menstruation was, to help them treat PMS-A. Anxiety and cravings. Cravings, by the way, come from also from the stress hormone. Because if you think about it, the first hormone that is lost from the adrenals is aldosterone. Aldosterone is the hormone that holds salt. So it's very, very common for a patient who is stressed to crave salt. We try and decrease that craving by giving the patient things like 5-HTP, which will help produce tryptophan and calm down the waters during the patient's high estrogen ratio. So it's not the amount of estrogen that you have, it's the estrogen and progesterone ratio. I dedicate this talk, it's a very short talk today, and I'll finish it off with a quote by Gibran for the children. You may give them your love, but not your thoughts, for they love their own thoughts. You may house their bodies, but not their souls, for their souls dwell in the land of tomorrow, which you cannot wish to dream. You may strive to be like them, but seek not to make them like you. For life goes not backward, nor tarries with yesterday, but like the archer who holds the bow steady, and guides the arrow into the air, and knows not where it will ever land. Take care of each other.